Today we were talking about how to fix that pinchy pain you get when you do squats. Now we're going to go over 5 different things that you can try, and you may or may not need to do all of them. Starting with what is the easiest change, and that is to simply use a slightly wider stance, turn the toes out just a little bit, and then make sure you keep your knees out in this position. When you get that pinchy pain in the front of the hip, oftentimes it's because you don't have enough mobility with how the leg and the pelvis are aligned. So by pushing the feet out a little bit and then turning the legs out, you can get a little more mobility and avoid that pinch. Next, we have stretching of what's called hip internal rotation. At the bottom of a squat, our femur relative to the pelvis moves into what's called internal rotation, where the thigh turns inward. Now, in this bottom position, when that motion is limited, we can't go down as deep as we need to in order to complete the squat. And sometimes people feel this as that pinch in the hip joint. A good way to fix this is to get down into a crab walk position, put the leg you want to stretch out to the side, and then actively pull that knee down and in. You should feel a stretch in the hip. You should not feel pain. If you do feel some pain, then add a band, put that around your upper thigh to pull the leg outward, and then do the exact same thing where you pull the knee down and then stretch the hip. Now the next 2 things kind of go hand in hand, but we're starting with strength of what's called the gluteus medius muscle. This muscle is responsible for keeping the hips and knees and feet lined up when you do a squat. When someone has a very weak muscle here, you'll see their knees move together as they go down and back up. By keeping this muscle strong, you can keep the knees out and then avoid that position where the knees go in, which pulls the hip in and causes that same pinch we've been talking about. A good way to strengthen this is by doing a side plank with the knees bent, and then if you want to add a clamshell, you can do that as well. Or if you're stronger than that, you can do the side plank with the knee straight and do what's called hip abduction with the straight leg. To go along with strengthening the glute med, we want to make sure we activate it when we're squatting. This is when you put the band around the knees. The point here is the band pulls the knees together, so that's cueing this glute muscle to fire to keep the knees out. Now, once you've sufficiently trained the glute to fire as you squat, you remove the band and hopefully muscle memory kicks in as you squat so that you don't let the knees move together and get that painful pinch. The last thing we're talking about here is your ankle mobility. Now, if you think about it, the ankle mobility, depending on how far your knee can go over your foot, is going to change the angle of the hips. So the more flexible the ankle is, the less bend you need in the hips. To correct this, what you can do is put your hands against the wall, put your foot out in front of you into a deep lunge position, and then try and push the knee forward while keeping the heel on the ground. If you don't feel much of a stretch there, put your toes or elevate the foot on some kind of incline, and then again try and keep the heel down and push that knee forward. You should feel a stretch somewhere in the Achilles tendon or in the ankle joint itself. Either way, by improving this mobility, you'll change how far the hip has to go, and then you'll avoid going to the point where you do get that painful pinch. I hope you found that helpful. If you did, I would appreciate a like. If you have comments, you can leave them in the comment section and I will try and answer that. Otherwise, if you want to subscribe to my channel, it's all about how we can build and maintain a healthy and physically fit body that will last throughout our lives so that we can continue to do the things that we want to do.